Welcome to PlacidWay Pulse, where we help patients understand medical travel options around the world in a simple, honest, and practical way. Today, we are taking a deep dive into mommy makeovers in Vietnam and why patients from countries like the US, Australia, and Europe are increasingly considering this option.
And it's a really fascinating shift to watch because we're seeing this massive demographic of women looking for solutions that just aren't accessible at home.
Right, exactly. And I mean, think about what pregnancy actually does to the human body. The connective tissue running down your abdomen literally separates. No amount of, Pilates or crunches can physically stitch that torn tissue back together. It's an engineering problem.
It really is. The physical realities of carrying and nursing a child, they fundamentally alter tissue volume, skin elasticity, and muscle placement. These are profound structural shifts.
Yeah, and you can't just exercise that away.
No, you can't. Diet and exercise simply cannot reverse it no matter how disciplined you might be. So we are looking at medical procedures to restore functional anatomy just as much as aesthetic contour.
But then, you hit the financial wall. In places like the US or Australia, you start pricing out these combined surgeries, a tummy tuck, breast lift or augmentation, liposuction, and the sticker shock just stops you in your tracks.
Oh, absolutely. You are easily looking at tens of thousands of dollars.
Easily. And worse, there is often a complete lack of transparent package pricing. You get a quote for the surgeon, but a week later you find out the anesthesiologist bills separately.
Right, or the facility charges this massive hourly operating room fee.
Yes. Even the post-op compression garments end up being an out-of-pocket extra. The final number is this moving target that puts the procedure entirely out of reach for the average family.
Which, forces a very pragmatic decision. Discovering global alternatives is rarely just a desperate search for a discount. I mean, it's a search for comprehensive value.
That's a great way to put it. It's about value.
Exactly. The data shows patients are realizing they can access highly specialized surgical expertise, transparent bundling, and incredibly detailed post-operative care by crossing borders. They aren't lowering their standards at all.
No, they're optimizing their healthcare investment, which is what forces patients to pull out a globe. And looking at the sources we've compiled for this deep dive, Vietnam is aggressively capturing this specific demographic.
They really are. The medical infrastructure there has seen just massive investment over the last decade.
Yeah, pivoting to serve international patients with this highly evolved vacation plus care model. Like in Vietnam, comprehensive mommy makeover packages start around $7,500 US. That fraction of the domestic cost bundles the surgeries, the hospital stay, and the dedicated aftercare.
And the scale of that infrastructure investment, it really cannot be overstated. Vietnam has spent years pouring resources into hyper-specialized health zones.
So they're building facilities specifically for this.
Exactly. They are building medical facilities specifically designed around the international patient journey, integrating clinical excellence with, true hospitality.
I want to break down what that destination actually looks like for a patient because the sources highlight two primary hubs offering very different recovery environments.
Right. Ho Chi Minh City and Da Nang.
Yeah, so first you have Ho Chi Minh City. This is a massive, vibrant metropolis. It holds the highest concentration of internationally trained plastic surgeons and state-of-the-art hospitals.
It's perfect for the patient who wants that high-end urban medical concierge experience.
Right. But then the other hub, Da Nang, seems to offer something physiologically different. It's a coastal city in central Vietnam with elite boutique facilities like Dr. Harvard plastic surgery.
Which is a totally different vibe.
It is. Recovering by the beach sounds lovely, obviously, but I'm curious from a clinical perspective, does a tranquil environment actually impact surgical recovery?
It actually does. It directly impacts wound healing at a cellular level. When you are in a bustling, high-stress environment, your body produces elevated levels of cortisol, which is our primary stress hormone.
And cortisol is bad news for healing. Right.
High cortisol actively suppresses the immune system. It reduces the number of lymphocytes in your blood, and it impairs the inflammatory phase that's necessary for initial wound healing.
Wow. Okay. So by recovering in a coastal, serene environment like Da Nang,
you are naturally modulating that stress response. Lower cortisol means a more robust immune response, less systemic inflammation, and ultimately a more efficient healing process. The environment is basically acting as a passive medical intervention.
Okay, sure. A beachfront recovery sounds ideal when everything is going perfectly, but I have to push back here on the realities of traveling abroad for major surgery.
Fair enough. It's a big deal.
It is. I understand the appeal of having a dedicated coordinator for your airport transfer or to order room service, but let's look at the clinical reality. What happens when there is a misunderstanding about pain medication at 3:00 a.m.?
That's a very common fear.
Yeah, like if you are in a boutique clinic in Da Nang and an actual medical emergency arises, how does a facility handle that if a language barrier pops up?
Well, you are identifying the exact threshold between a cosmetic spa and a true medical facility. The top-tier clinics in Vietnam operate under strict medical protocols where the core clinical staff are fluent in English.
Especially the overnight staff.
Exactly. The overnight monitoring nurses and the on-call physicians speak English. But more importantly, true medical emergencies are mitigated by standard operating procedures. These boutique clinics do not function as isolated islands.
Okay, so they're plugged into the wider system.
Yes. They have intensive care protocols and rapid transfer agreements with major regional hospitals. Plus, the pre-travel virtual consultations ensure that your complete medical history and emergency action plans are mapped out weeks before you even board the plane.
So the safety net is built into the logistical framework before the surgery even begins. That brings up the issue of vetting, actually.
Well, how do you know who to trust?
Exactly. I hear JCI accreditation thrown around a lot in medical tourism as the, ultimate gold standard. Should a patient just filter for JCI and ignore any clinic that doesn't have it?
I'm glad you asked that. JCI Joint Commission International is a fantastic credential, but we have to understand its purpose. It is designed to evaluate massive multi-department hospitals.
So making sure the ER talks to the oncology ward.
Right, ensuring all those massive units are communicating safely. A hyper-specialized aesthetic boutique in Vietnam might bypass JCI simply because they aren't running an ER. They don't fit that multidisciplinary model.
That makes total sense. So over-relying on JCI means you might miss out on elite specialized surgical centers.
Exactly. You'd be filtering out some of the best boutique surgeons in the country.
Well, if JCI isn't the only filter, how do we evaluate a clinic's safety realistically? What are the actual trust markers people should look for?
You start with the Vietnamese Ministry of Health. They have exceptionally strict, specific standards for aesthetic surgery facilities. You also look for surgeons who are board certified, often with international fellowships in places like South Korea, the US, or Europe.
Okay, so local licensing and international training.
Yes. But inside the operating room, the absolute non-negotiable trust marker is the presence of a dedicated, certified anesthesiologist.
Not just the surgeon handling everything.
Never. You want a separate medical doctor whose sole responsibility is continuously monitoring your vitals, managing your airway, and adjusting sedation. That allows the plastic surgeon to focus 100% on the actual procedure.
Let's dive into the technology those surgeons are using because, reading through the clinical profiles in our sources, the standard of equipment is incredible.
It really is cutting edge.
Yeah, and it starts before the anesthesia even kicks in. The sources detail clinics utilizing 3D imaging systems, specifically mentioning something called the VECTRA XT.
Oh, the VECTRA XT completely changes the preoperative consultation. It's amazing.
Let me try to explain how I understand this system. You tell me if I'm off base. They essentially take a high-resolution 3D scan of your body.
Yep, exactly.
Then, using the software, you and the surgeon can manipulate the image in real time. You can actually visualize what a specific volume of breast implant looks like on your unique rib cage, or what a certain degree of abdominal contouring will do to your silhouette.
That's spot on. It takes the subjective guesswork completely out of the consultation.
Which is huge, because otherwise you're just pointing at a magazine and hoping for the best.
Right. It creates a visual contract. You move from a patient saying, I hope I look like this reference photo, to the surgeon saying, based on your anatomical scan, this is the precise geometric outcome we are targeting.
It aligns expectations perfectly. And that reliance on advanced technology extends directly into the surgical techniques, too, specifically for the liposuction component of the Mommy Makeover.
Yes, top clinics in Vietnam are utilizing VASER, or power-assisted liposuction, which is known as PAL.
I want to visualize this, too, because traditional liposuction always sounded incredibly harsh to me. It seems like trying to scoop cold, hard butter out of a plastic tub. Like you have to use so much physical force that you inevitably scrape and damage the container itself.
That is a very visceral but highly accurate way to picture it. Traditional lipo is traumatic to the tissue.
But VASER uses ultrasound to basically melt the butter first, right?
Exactly. VASER emits high-frequency ultrasound waves from the tip of the probe. These ways specifically target and liquefy fat cells without damaging the surrounding tissue matrix.
So by melting the butter, the surgeon can gently siphon the fat away rather than aggressively scraping it out.
Right. And PAL operates on a similar principle of reducing physical trauma. It uses a specialized cannula with a rapidly vibrating tip to break down dense fibrous fat.
Which means the blood vessels and nerves within that tissue matrix are preserved.
Exactly the point. Less trauma to the blood vessels translates directly to dramatically less bruising, reduced postoperative swelling, and a much faster, less painful recovery period.
And it probably gives the surgeon more control, right?
Oh, definitely. It allows the surgeon an incredibly high degree of precision when contouring delicate areas.
Okay, so that's the lipo. Then there is the tummy tuck aspect. This brings us back to that engineering problem we discussed at the start of the deep dive. The sources emphasize that these surgeons aren't just pulling loose skin tight and trimming it.
No. That's a common misconception about tummy tucks.
Right. They are performing tummy tucks that structurally repair separated abdominal muscles.
We're talking about diastasis recti. During pregnancy, the linea alba, which is the connective tissue running vertically down the center of the abdomen, is stretched to its absolute physiological limit.
Right, accommodating the baby.
Exactly. And for many women, it thins out and tears, causing the left and right abdominal muscles to permanently separate. The structural integrity of the core is totally compromised.
So what does the surgeon actually do?
During a full tummy tuck, the surgeon goes beneath the fat layer, physically pulls those separated muscles back to the midline, and sutures them together, from the rib cage all the way down to the pelvis.
They are essentially constructing an internal corset using the patient's own musculature.
They are restoring the abdominal wall's original tension. This not only creates a flat profile, but stabilizes the core.
Which has to feel so different for the patient.
It does. It often resolves secondary issues like lower back pain and posture problems that mothers suffer from for years post-pregnancy.
That's incredible. And alongside all this high-tech imaging and intense surgical reconstruction, the sources highlight a completely different, deeply human element to the whole process.
The patient experience side of things.
Yeah. There is a detailed review from a patient named Lawyer Fernandez who traveled to Dr. Nan Ho's clinic in Ho Chi Minh. She praised the surgical outcome, obviously, but the core of her review is actually about the nursing staff.
Really? What did she say?
She specifically highlighted a nurse named Nurse Nu, noting how her warmth, constant attentiveness, and genuine kindness made Lawyer feel like part of a family during a very vulnerable recovery.
That is so important. And going back to our earlier point about cortisol and wound healing, Nurse Nu is actually delivering clinical value through empathy.
Clinical value through empathy. I love that.
It's true. When a patient wakes up in a foreign country after major surgery, their sympathetic nervous system is on high alert. Experiencing genuine warmth and feeling safely looked after actively downregulates that stress response.
So the bedside manner is not a luxury add-on?
No, it is a vital component of the healing environment.
Which brings us to the actual timeline of that healing environment. Because a mommy makeover is a massive physiological trauma. I mean, you are combining abdominal reconstruction, breast surgery, and liposuction. You cannot just get stitched up and hop on a 15-hour flight back to Sydney or Los Angeles the next afternoon.
Attempting to do so would be incredibly dangerous. The standard medical requirement in Vietnam for a mommy makeover is a mandatory 2 to 3 week stay.
Walk us through the structure of those weeks. How is that time actually utilized?
Well, the first 1 to 2 nights are spent as an inpatient right at the clinic or the partnered hospital. This is the acute phase.
So you're closely watched.
Very closely. You are monitored continuously by medical staff. Your pain is managed intravenously, and they ensure your vitals are perfectly stable. Once you clear that 48-hour window, you are discharged to recover locally.
So you transition to a private recovery suite or a partnered luxury hotel for the remaining 14 to 21 days. You know, I look at this required local recovery period as a forced, luxurious timeout. For a mother who is usually the CEO of her household, managing schedules, making meals, anticipating everyone else's needs, this time frame in Vietnam completely isolates her from those demands.
It physically removes her from the chaos.
Right. She physically cannot do the laundry or make dinner. Room service brings her food, the clinic coordinates her transport, and her sole responsibility is to focus 100% of her energy on healing.
It is a rare period of absolute self-focus.
Yeah.
And the clinic structure this time rigorously. This is not a vacation where you are just left alone in a hotel room to figure it out.
Okay, so what does that structured time look like?
During these weeks, You undergo highly structured aftercare. You have multiple scheduled follow-up visits with your surgeon. The nursing team monitors your incision sites, performs precise dressing changes to prevent infection, and manages your surgical drains.
The surgical drains are a huge factor. You absolutely cannot board a commercial flight with tubes draining fluid from your abdomen.
No, absolutely not. The clinic staff tracks that fluid output daily and removes the drains only when your body has safely adapted. They also fit you with specialized compression garments.
Explain the mechanism behind those garments because they sound incredibly uncomfortable, but are apparently vital.
They are vital. When you remove fat and surgically detach skin to tighten it, you create empty space beneath the tissue. The body's natural inflammatory response is to fill that space with fluid.
So the body just wants to swell up.
Exactly. Specialized compression garments apply constant, calculated pressure across the surgical sites. This physically prevents excessive fluid buildup, forcing the body to reabsorb it.
Oh, okay.
Furthermore, it holds your newly sculpted tissues firmly against the underlying muscle, allowing them to heal and adhere in their new position. Without strict compression, the contouring work can be completely compromised by swelling.
Wow. The sources also mention lymphatic drainage massages being integrated into this recovery period. Let me test my understanding of this mechanism, too.
Go for it.
The lymphatic system doesn't have a central pump the way the cardiovascular system relies on the heart, right? It relies almost entirely on the physical movement of your muscles to push lymphatic fluid around.
That's exactly right.
So when you are lying in a recovery bed for 2 weeks, barely moving, that fluid just pools at the surgical site, causing massive swelling. This specialized, gentle massage basically acts as an external heart.
That is a perfect analogy. The lymphatic system is your body's primary waste disposal network. It's responsible for clearing out cellular debris and excess fluid after trauma.
And the massage therapist helps it along.
Yes. By applying specific rhythmic pressure, the therapist manually pumps the waste toward the lymph nodes, artificially stimulating a system that is currently dormant due to your lack of mobility.
Which speeds everything up.
It really does. It accelerates the resolution of swelling, flushes out inflammatory byproducts, and significantly reduces post-operative pain.
As incredible as that comprehensive aftercare sounds, 3 weeks is still a massive investment of time. I mean, it means 3 weeks away from children, from jobs, from daily life. I can imagine patients wanting to negotiate this.
Oh, patients try to negotiate this all the time.
Right? Like, why not just get the drains removed on day 5, endure the swelling, and fly home to finish recovering in your own bed?
It's tempting, but the answer comes down to an absolute non-negotiable medical risk, and that's deep vein thrombosis, or DVT.
Let's break down the biology of DVT and why it makes early travel impossible.
Sure. So deep vein thrombosis is the formation of a blood clot within a deep vein, typically in the legs. Any major surgery, especially abdominal surgery like a tummy tuck, puts your body into a hypercoagulable state.
Meaning your blood wants to clot more easily.
Exactly. Your blood naturally thickens because your body is trying to clot the surgical wounds. You are already at an elevated risk. If you combine that hypercoagulable state with sitting immobile in a cramped airplane seat at a high altitude for a 10 to 15-hour flight.
The blood just stagnates.
Yes. The blood in your lower extremities stagnates, and the risk of a clot forming skyrockets.
And if that clot breaks loose from the leg and travels up through the bloodstream,
it enters the lungs, causing a pulmonary embolism, which is immediately life-threatening.
Oh, wow. So it's not just about comfort.
Not at all. The 2 to 3 week recovery window is not an arbitrary suggestion. It is the medically accepted timeline required for your internal inflammation to subside and your mobility to increase to a point where a long-haul flight is physiologically safe.
And someone signs off on this, right?
Yes. Before you are allowed to fly home, the surgeon conducts a final checkup to formally clear you for air travel. They are verifying that your body has crossed the threshold out of that danger zone.
It really puts the entire journey into perspective. You are committing to a serious medical intervention that requires meticulous planning, a significant block of time, and the willingness to navigate a foreign healthcare ecosystem.
Which is exactly why attempting to piece together this journey from random internet forums is a recipe for overwhelming stress.
Oh, absolutely. But navigating international medical travel doesn't have to be a shot in the dark. That is exactly what PlacidWay helps patients avoid.
Right. They take the guesswork out of it.
They really do. PlacidWay helps you explore these specific medical travel options by connecting you with vetted international providers in places like Vietnam. They help you compare the transparent costs, understand the distinct advantages of recovering in Da Nang versus Ho Chi Minh, and provide you with the critical questions you need to ask during those virtual consultations.
So you're not just flying blind.
Exactly. They help you move through this complex medical journey with total clarity and confidence.
And, evaluating this model in Vietnam challenges us to look differently at how we experience healthcare as a whole.
How so?
Well, often the catalyst for looking abroad is purely financial. We just want to afford the surgery. But what patients actually discover is a paradigm where acute medical intervention and holistic, peaceful recovery are seamlessly woven together.
It's the full package.
Right. By combining world-class surgical technology, rigorous safety protocols, and a culture of profound hospitality, it forces us to redefine what the standard of patient care should actually feel like. It elevates the process from a clinical transaction to a comprehensive healing experience.
And that brings us full circle to the mother looking for a solution. A mommy makeover is about resolving a physical disruption, about restoring the structure so you can feel at home in your own body again.
Exactly.
What the data shows is that looking beyond your own borders might just offer an environment where the journey to heal is as deeply supported as the surgical result itself. Thanks for taking this deep dive with us. Keep questioning the standard, and we will catch you next time.